Causes of renal calculi. Kidney stones form when there is a decrease in urine volume and/or an excess of stone-forming substances in the urine. The most common type of kidney stone contains calcium in combination with either oxalate or phosphate. The majority of kidney stones are calcium stones. Other chemical compounds that can form stones in the urinary tract include uric acid, magnesium ammonium phosphate and the amino acid cysteine. 1. Dehydration from reduced fluid intake or strenuous exercise without adequate fluid replacement increases the risk of kidney stones. 2. Obstruction to the flow of urine can also lead to stone formation. In this regard, climate may be a risk factor for kidney stone development, since residents of hot and dry areas are more likely to become dehydrated and susceptible to stone formation. 3. Infection in the urinary tract. These are known as struvite or infection stones. For metabolic abnormalities, including inherited disorders of metabolism, can alter the composition of the urine and increase an individual's risk of stone formation. 5. Medical conditions can lead to an increased risk for developing kidney stone. Gout results in chronically increased amount of uric acid in the blood and urine and can lead to the formation of uric acid kidney stones. Hypercalciuria. High calcium in the urine, another inherited condition, causes stones in more than half of cases. In this condition, too much calcium is absorbed from food and excreted into the urine, where it may form calcium phosphate or calcium oxalate kidney stones. C. Hyperparathyroidism. D. Renal tubular acidosis. E. Cystinuria and hypoxaluria. F. Diabetes and high blood pressure. Hypertension. G. Inflammatory bowel disease. H. Those who have undergone intestinal bypass or ostomy surgery are also at increased risk for kidney stone. Some medications also raise the risk of kidney stones. These medications include some diuretics, calcium-containing antacids, and the protease inhibitor inbanabir crixivan, the drug used to treat HIV infection. J. Dietary factors and practices may increase the risk of stone formation in susceptible individuals. 1. Inadequate fluid intake. 2. High intake of animal protein, a high-salt diet, excessive sugar consumption. 3. Excessive vitamin D supplementation, and excessive intake of oxalate-containing foods such as spinach. 4. Low levels of dietary calcium intake may alter the calcium oxalate balance and result in the increased excretion of oxalate and a propensity to form oxalate stones.